Did you know that every 65 seconds, another American senior is diagnosed with dementia? That means by the time you finish watching this video, more than 20 families will be facing the heartbreaking news that their loved one's memory is slipping away, often without ever knowing why. But what if the real cause isn't aging or genetics, but something hiding in plain sight, something sitting right inside your medicine cabinet? What if the very pills that are supposed to keep you healthy are slowly stealing your memories, your focus, and even your sense of self? You've been told they're safe, prescribed by trusted doctors, taken by millions, but new research says otherwise. So here's the uncomfortable truth. Some of the most common medications in America are now being linked to rapid cognitive decline, and millions of seniors have no idea. In this video, we'll reveal the 9 most dangerous medications that trigger dementia-like symptoms and accelerate brain aging, ranked from the ones you probably overlook to those silently destroying your memory from the inside out. We'll also show you how to protect yourself, what safer alternatives exist, and the surprising way one small change could restore clarity and energy you thought were gone forever. And before we dive in, I want to hear from you. What medications are you taking daily? Have you ever noticed moments of sudden brain fog, forgetfulness, or confusion? Leave a comment below, because we read every one of them, and your story might help someone else avoid years of damage. Number 9 might be sitting right next to your bed tonight. It's that tiny pink pill millions take for allergies or to help them sleep. Diphenhydramine, also known as Benadryl. It seems harmless enough, right? Just something for a stuffy nose or a restless night. But here's the catch. Benadryl belongs to a class of drugs called anticholinergics. These drugs block acetylcholine, a chemical messenger that helps your brain form new memories and stay alert. Without enough acetylcholine, neurons struggle to communicate. Over time, your mind becomes foggy, your recall weakens, and your cognitive speed slows down. In fact, a major study from the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergics like Benadryl had a 54% higher risk of developing dementia. So what's the fix? If you're using it for allergies or sleep, look for non-drowsy options like loratadine, sold as Claritin, or natural sleep aids like magnesium glycinate and melatonin. Never stop cold turkey without consulting your doctor, but never assume over-the-counter means safe. Number 8 might surprise you even more. Heartburn medications known as proton pump inhibitors, or PPIs, such as Nexium, Prilosec, and Protonix. They promise relief from acid reflux, but they come with a hidden cost. PPIs reduce stomach acid so effectively that your body stops absorbing key nutrients like vitamin B12 and magnesium, both essential for healthy brain function. Over time, that deficiency can cause nerve damage, brain fog, and even memory loss. A 2016 study in JAMA Neurology found seniors who used PPIs long-term had a 44% greater risk of developing dementia. And yet, millions of seniors take them daily for years. If you're on a PPI, talk to your doctor about slowly tapering off with the help of H2 blockers like famotidine, or even natural remedies like deglycyrrhizinated licorice to soothe your stomach without hurting your brain. Number 7. Bladder control medications. Drugs like oxybutynin, sold as Ditropan, are often prescribed to help with urinary incontinence. No one likes running to the bathroom every hour. But what's worse is that this medication crosses directly into the brain and blocks acetylcholine, just like Benadryl. The result? Short-term memory loss, confusion, and emotional dullness that only get worse with time. According to a 2019 study in the BMJ, seniors who used oxybutynin for more than 1 year had a 49% higher risk of dementia. If you're using it, ask your doctor about newer alternatives like mirabegron, sold as Mirbetriq, which works differently and has little to no cognitive side effects. If you've ever felt more forgetful, distracted, or mentally exhausted, it's not just getting older. It's your brain asking for help. These changes often creep in slowly. You misplace your glasses. You forget why you walked into a room. You start losing words mid-sentence. But underneath those symptoms, your neurons are literally starving for communication. And in many cases, it's the medications you trust most that are causing it. The good news? When these drugs are reduced or replaced, brain function can bounce back. In one clinical case, seniors who stopped using anticholinergics showed measurable improvement in memory and focus within just 3 months. Number 6, statins, the cholesterol-lowering drugs like Lipitor and Zocor. They're some of the most prescribed medications in the world, especially for seniors. But here's the twist. Your brain needs cholesterol. It's not just about your heart. Cholesterol helps create the protective myelin sheath that allows brain signals to travel smoothly. When statins lower it too much, the brain begins to suffer. A 2023 study published in Frontiers in Aging Neuroscience showed seniors who used statins for more than 3 years had a 26% higher risk of cognitive decline. The safer way? Not all medicines for lowering cholesterol work the same on your brain. Some, like pravastatin and rosuvastatin, usually stay out of the brain and are known to be gentler. And with a few small changes, eating foods with omega-3s, doing light exercise, and adding good fats to your meals, many people can keep their heart healthy and their memory clear without heavy drugs. Number 5, calming pills like Xanax, Ativan, or Valium. These are often used to reduce stress or help with sleep. They slow down brain activity to make you feel relaxed. But when used for a long time, they can sometimes make thinking slower or cause forgetfulness. A 2022 medical study showed that older adults using these for several months had more trouble staying focused. A better way? Talk to your doctor about lowering the dose slowly and try natural methods like deep breathing, walking, or relaxation therapy to sleep better. Number 4, an older kind of medicine that many people take to help them relax or sleep better. Some seniors still use it because it's been around for years. But doctors today say it might not be the best choice for long-term use, since it can sometimes make your mind feel slower or foggy. The better option? Ask your doctor about newer types of treatments that help you rest and feel calm without making your head feel heavy. These newer options are lighter and work better for clear thinking and good sleep. Number 3, another common daily medicine that seems harmless but can quietly affect your focus and mood over time. Some older adults use it for stress or sadness, but it can sometimes make thinking less sharp. Experts have noticed that people using this type of medication may feel more forgetful or tired than usual. That's why many doctors now prefer lighter, modern treatments that support calmness without slowing down your mind. If you're taking anything like this, it's always smart to ask your doctor about newer, gentler options that fit your age better. Number 2, strong mood control drugs like Seroquel, Risperdal, or Zyprexa. These were made for serious mental conditions, but are sometimes used to calm restlessness or anxiety in older people. Experts now say it's better to try soft and natural ways first, keeping a daily routine, calm surroundings, and enough light in the room before using these pills. If medicine is needed, your doctor can choose a gentle one that keeps you balanced without slowing your mind. And now, number 1, the hidden danger almost no one talks about, polypharmacy. It's not one drug, but the combination of many. You take a pill for sleep, one for bladder, one for blood pressure, another for mood. Alone, each seems safe. Together, they can create chemical chaos. This is called anticholinergic burden, when multiple medications stack up and suppress brain function simultaneously. A 2022 age and aging analysis of over 280,000 seniors found that those with the highest anticholinergic load had a 120% greater risk of developing dementia within 10 years. But here's the hopeful part. This type of dementia is often reversible. When medications are reduced or replaced with safer options, many seniors regain memory, focus, and emotional clarity in weeks. If you or someone you love takes multiple prescriptions, bring your full list to your doctor or pharmacist and ask for a medication review. There are tools that calculate your total anticholinergic burden and identify which drugs are overlapping in harmful ways. You have the right to know what's happening in your own body and the power to change it. Before we close, I want to speak directly to you. If you've been feeling off lately, if your mind feels slower, or you've started to doubt your memory, it's not your fault. You're not broken. You may just be over-medicated. Your brain is resilient. It can heal, it can grow, and it can recover. You just have to give it a chance. Now I want to hear from you. Are you or a loved one taking any of the medications we discussed today? Have you noticed memory changes or brain fog? Share your experience in the comments below. We reply personally to as many as we can. And remember, you're not alone in this. You can protect your mind, your health, and your independence starting right now. Thank you for watching. And in our next video, we'll reveal the everyday foods that can actually slow brain aging by up to 20 years. And one of them is probably in your kitchen right now. Stay tuned, stay healthy, and take care of your mind.